When it comes to health inequities, Minnesota ranks amongst the worst in the country. Hennepin Healthcare, one of the largest healthcare systems in the metro, is taking steps to ensure quality healthcare for all. 360's Maneeya Leung has the story.
So health equity is the opportunity to allow people to have the resources necessary in order to live their most optimal healthy life.
Dr. Nneka Sederstrom is the Chief Health Equity Officer at Hennepin Healthcare. It's the first position of its kind.
There are a lot of diversity and inclusion officers, but none that are just focused on health equity as an outcome.
In her role, Dr. Sederstrom works to end health disparities in communities of color.
Minnesota has some of the worst health disparities in the country, especially around Black and brown people. Diabetes, cancer, heart disease. We look at the differences between our white population and our various of color populations. And then we look at things like access, how my doctor treats me. There's some like individualized measures.
Racial inequities in healthcare can lead to disproportionately higher rates of chronic illness and death in communities of color. One reason, people of color are more likely to face barriers to quality care.
The disparities in Minnesota are really bad. They are, like I said, they're the fourth worst in the country, and mostly because there has been this undercurrent of sort of sustained racism that hasn't really been addressed ever.
Dr. Sederstrom addresses these issues with her many initiatives, such as recruiting more doctors of color. She also works to educate colleagues on what they can do to create a healthcare system that works for everyone.
We definitely can't move forward if we don't work together. It's just not going to happen. Addressing racism and issues of access and barriers to care is not a one kind of person thing. It is an every person thing. So we have to be unified in this.
Reporting for 360 Journalism and Blue Cross, I'm Maneeya Leung.